Hi, I'm Dr. John Harper from Oceanside, California, and I'm here with Craig Packard of Oceanside. And Craig is a peripheral neuropathy patient of ours, and so he's graciously offered to do this testimonial with us. So, Craig, I remember you came to one of my workshops, right, for
Yes.
peripheral neuropathy?
Yes.
And what was it about the workshop that made you decide that you wanted to come in just to see if we could help you? Was there anything
I
you remember?
just saw a man, he was in the presentation and he displayed what he had gotten through the program, and I liked what I heard, and we just kind of followed through with it because I wanted to get well and get healthy.
Good, great. Yeah, so it was the another patient of mine who came to the workshop
Yes.
and stood up and told you about
Yes,
what was
yeah.
going on. Okay, great. And when you came in, were we real straightforward about what we do and
Yes.
why, and everything was in
It's
writing?
very self-explanatory. Yes, everything was in writing. You allowed me to ask questions that concerned me, which was important because a lot of other places I went to, they wouldn't let me ask questions. They just wanted to give me a pill and send me out the door. But you guys showed a lot more concern, and I felt like you guys cared about me and wanted me to get well, and that's what I was looking for, somebody that cared.
Good, good. And so what kind of problems did you have before you came in the office?
I went to the doctor. He was a neuropathy doctor for nerves, and my left leg, he said, more or less was dead when he hit the joint. And I said, well, what the hell do we do about it? And he said, well, take this pill and then come back and see me. Well, I never took the pill. And then my wife, who does a lot of searching on the internet, she found Dr. Harper in Oceanside. So we went to the presentation, and, here we are today, feeling much better, and can't say enough.
Good, great. You just told me a story that where you were having a hard time just walking, and you just said you were down at the beach with your dog, and what happened then?
For the reason of coming here all these months, it kind of paid off because I got to run up the hill there in Oceanside with my dog, and I beat my dog, and I haven't been able to run for probably 2 years. And I'm not talking about a long distance, I'm talking about a sprint. If there was an emergency, I could get myself to the right place and take care of myself. Before, I don't think I could have. I would have went maybe 20 yards and been out of gas, and my leg would have been hurting. I would have had to sit down. It was not good.
No.
But
And now you could run uphill?
Oh yes, I can take care of myself, and that was my whole goal in coming here.
Great.
Is when I wanted to feel better and take care of myself.
Great. And along with working with the peripheral neuropathy, we worked a lot with your general health, right?
Yes.
You were borderline diabetic, you were on high blood pressure medicine, and you just showed me a piece of paper that your physician wrote something on that paper. What did he write?
No more pills.
No more pills.
No more drugs.
All those medications that you were on for other problems.
Yes.
He did your blood work, and you actually shared that he said your blood works better than his.
Right.
Yeah, all right, very good. That's excellent. Well, and that's great, Craig, because that was one of your goals, was to get off all your meds, right?
That was more or less for that. My main goal was my meds and my walking. I wanted to walk.
Good, that's great. How old are you, Craig?
I'm 59 years old.
59 years old, and at this age, you can still get better and healthy. Isn't that
Yes.
amazing? Good
And
deal.
this is a way of life I can live with. It's tolerable. My wife's on the program. We work together at it. It's like it's drawn us a little closer together because now we're more of a team on the things that we do.
Beautiful, great. So, last thing, Craig, is that, well, two things. First of all, staff treat you right? Good people?
Oh yeah, excellent. Very warm, very nice. They care about you.
Good.
It's not like you just come in and you're a number. They do care about you.
Yeah, well, that's great. And last thing is that, Craig, if would you refer people to my office? Does this make sense?
Oh,
to say?
100%. If you want to walk and feel good, you want to do the things you used to do. You want to take your grandkids to Disneyland. You want to go walk on the beach with your spouse or whatever. You want to hike in the Sierras and go fishing. This is going to give you a lot more to work with, because you're going to learn how to take care of your body. You're going to know how to hydrate yourself before the walk. You're going to know what to eat and what makes you feel good. So that's kind of what I've learned through this thing, that it's a trustworthy program that I like.
Very
And
good.
it works for me.
Very good, Craig. And I just want to tell you thanks. You followed the program. You've had great results. Your life has totally changed. Even you're calmer, more relaxed. You're all these good things, and so that's really great. So thank you very much, Craig. I really appreciate it. And
Well, thank you for accepting me.
Very good. You have yourself a great day.
Okay, thank you.